Good morning. Today we'll actually start with Marion Dowling, so I'll turn it over to Marion to lead off, and then I'll give my update.
Good morning, everyone. Happy to be back with you here this morning. Health PEI and our joint response team is focused on planning and preparation for the coming months, so we're ready for any potential cases of COVID-19. We continue with training for clinical teams that will be on the front line of providing care to patients during the pandemic. As well, we're recruiting for additional staff to ensure we have the capacity to manage any surge in cases. Our recruitment campaign is ongoing, and we've already had success in hiring 20 additional casual staff, including RNs, LPNs, service workers like housekeeping, laundry, or nutrition services staff, residential care workers, and clerks. Several others have expressed interest in our campaign and are at various stages through the hiring process. We still have a need for more temporary staff to ensure we can expand to provide the needed care for people with COVID-19 and to work at our COVID-related services such as our testing and screening clinics. Anyone who is interested in these positions should email healthpeihr@gov.pe.ca to inquire. While we plan for the future, we're also working to make sure we've made the most of the time between cases. Our surgery volume has been at or exceeding previous year levels for several weeks now. To date, 48% of the surgeries that were postponed during our shift to essential services have been completed. Emergency surgeries, of course, have continued at both the Prince County Hospital and Queen Elizabeth Hospital throughout the entire period of the pandemic. Our COVID-19 testing clinics continue to be very busy, as does our laboratory. Yesterday, we saw 140 people in our Charlottetown clinic, 58 in our Summerside clinic, and 30 at the Borden Carleton testing site, for a total of 228 tests. Thank you once again to the staff and physicians within Health PEI and our partner organizations who are working so hard to prepare for the coming waves of this pandemic, while we also continue to provide high-quality care to Islanders. To our patients, please remember our services are safe. Please come to your appointments and seek care if you need it. And please remember to bring and wear a mask or face covering to help protect everyone. Thank you. Dr. Morrison.
Thank you, Marion. So good morning again. I'd like to begin today by reflecting a little on the progress we've made since March in the midst of this pandemic. We now have the capacity to do up to 2,000 COVID-19 tests in the province per week. And when the pandemic began, we were sending tests to the National Microbiology Lab in Winnipeg and waiting days for the results. So thank you to our amazing partners at the Provincial Lab for their ongoing work in processing COVID-19 tests and also their input on testing regimes. Since the beginning of the pandemic, over 22,000 tests have been performed, including 1,300 in the past week. We've established COVID-19 testing clinics throughout the province, Charlottetown, Summerside, and Borden, in addition to the mobile service offered by Island EMS. Testing is a key pillar of our COVID-19 response, and thank you to our partners at Health PEI and Island EMS for their role in providing accessible, high-quality testing services. Our partners in Justice and Public Safety have instituted a process to grant pre-travel approval for people wanting to travel to the province, and we have welcomed seasonal residents, essential and specialized workers, and people traveling due to compassionate reasons, family support, bereavement, and family connections. We've instituted a border screening process whereby all residents returning to PEI, essential workers, and visitors are screened at the points of entry. At the Confederation Bridge, this work, of course, is 24/7, rain or shine. And we could not do this work without the support of highway safety, police, environmental health, Northumberland Ferries, the Charlottetown Airport Authority, Strait Crossing, the Magdalen Islands Ferry, summer students, and casual staff. Since the Atlantic bubble began on July 3rd, we have screened 78,100 vehicles at the bridge and Wood Island's ferry, and over 175,000 passengers. Since April, 331 vehicles, 462 people have been denied entry to PEI due to lack of pre-travel approval or proper identification. A process has been established to have daily contact with people in self-isolation, with 841 currently in Operation Isolation, and almost 8,000 having completed the 14 days of self-isolation. We have established a process in partnership with the Department of Transportation, Infrastructure and Energy, and the Office of Immigration, Public Health Nursing, and the agriculture and fisheries sectors to welcome almost 500 temporary foreign workers to the province since May the 1st. These individuals provide essential services in our primary sectors of agriculture and fishing. We've created a 1-800 line for health-related inquiries, and staff have responded to over 13,400 calls, including requests for information and complaints. Public safety has completed 428 compliance checks, issued 145 warnings and 36 fines. There are many more examples of processes that have been established to help keep islanders safe. While they have not all been perfect, we continue to learn and adjust as needed. Thank you to Islanders and visitors for your patience and understanding as we continue to navigate through this global pandemic. When the pandemic began, there was no playbook for responding to COVID-19. We've made policy and operational decisions made based on the best available evidence, and in some cases, it was emerging evidence. We were, however, fortunate to have a general provincial pandemic plan that provided some guidance and a daily reminder of the priority and goals we need to achieve during a pandemic. To minimize illness and death in the population, to limit societal disruption and impact on families, individuals, and society, and to quickly detect and isolate cases of COVID-19 and mitigate community transmission. While there is still no playbook, we know much more about COVID-19 now than we did in March. As new evidence continues to evolve, our approaches and guidance change to reflect new information. There is still a long road ahead of us with COVID-19. We will continue to make the best decisions with the information available. We just do not know how and where this virus will move in the coming months. However, we can influence how COVID-19 affects us as individuals and collectively as a community. We know that basic public health measures, physical distancing, hand washing, masks in closed indoor spaces, have been effective in keeping the rate of COVID-19 low in our province. We know this virus spreads efficiently in large gatherings and in the absence of precautions. So we've said it before, we cannot let our guard down, and we must be careful about how we interact with others and who we interact with. We must continue to keep our circles small and avoid situations where we do not know most of the people present. Our individual actions and behaviors have a significant impact on others, and what we do now does matter. I am glad to report that we continue to have no new cases of COVID-19 in our province and that all 36 of our cases are recovered. It has been 28 days since our last case of COVID-19 was announced. All our cases of COVID-19 have been travel related, and we are in a unique position in Canada because we've been able to identify a probable source of infection for all of our cases. However, there have been over 20 million cases of COVID-19 around the world and more than 736,000 deaths. In Canada, there have been now over 120,000 cases, but 88.5% of these cases are recovered as of today. 41% of our domestic cases in the last week are among those 29 years and younger. And positive note, the most recent week saw a 15% decrease in cases in Canada compared to the previous week. Last week, the Department of Education and Lifelong Learning announced the back-to-school plan for the upcoming school year. And we know that schools will plan to reopen across the province on September the 8th. I know this may be an uncertain time for many families. Returning to school is about much more than education. It is about overall health, well-being, and development of our children. We have to work together as families and communities to support our children, our school system, our teachers, and our school staff. As I stated previously, the back-to-school plan was developed based on our local epidemiology. If the incidence of COVID-19 changes in PEI, we may need to adjust the school plan. Some measures may be relaxed, but some may need to be more stringent. The public health system will be ready and available to respond if and when there are cases of COVID-19 in our schools. We will conduct contact tracing and testing and provide guidance to the school and the education system in order to contain any situation. Over the next few weeks, I do encourage parents to help their children get ready for the new normal in schools by encouraging hand washing. And similar to the Public Health Agency of Canada guidelines that came out late last week, which had very similar recommendations to our own around non-medical masks, strongly recommended in those grades 7 to 12. We need to also teach our children how to don and doff a mask properly. We have to explain why sharing in food and toys is not allowed, and encouraging our children to be patient and kind toward others, including their classmates and teachers, and helping them develop strategies to maintain as much distance as possible from others. The World Health Organization recently noted the foundation of successful school reopening is adequate control of COVID-19 transmission at the community level. Our children need our collective help to ensure a safe return to school and a full year of learning. We need to work together to support the successful reopening of schools by keeping the prevalence of COVID-19 low in PEI and containing any community transmission. The arrival of international students to attend our post-secondary institutions is a concern, as we know there is a risk of importation of COVID-19 into PEI. Many of the post-secondary international students are in the 20 to 30 year age range that often may not perceive they are at risk of getting the virus and may feel invincible. Moreover, some students are coming from areas with a high prevalence of COVID-19. While in a normal year there would be over 2,500 international students in PEI, this year is different as the post-secondary institutions have adjusted their programs to accommodate more online learning. We are expecting approximately 500 international and Canadian post-secondary students to arrive, starting from outside the Atlantic bubble this morning, and more may be arriving in January. There will be a number of additional international students arriving to attend classes in our K-12 system, and we anticipate having more details available in the coming days. Our office is working with UPEI, Holland College, and Collège de Lille to finalize their respective plans to ensure that international and Canadian students arriving from outside the Atlantic bubble have an acceptable self-isolation plan. It is incumbent on the institutions to provide the necessary supports to students during the 14 days of self-isolation. Canadian students arriving from outside the Atlantic bubble will be required to have pre-travel approval, including the acceptable self-isolation plan. These students may self-isolate in their accommodations or at a hotel. But all international students who are arriving from outside of Canada will be self-isolating in designated hotels that will be monitored 24/7. The students will be tested at day 10 to 12 of their isolation period. Some returning international students have remained in this country over the summer, and their requirements to return to PEI will be similar to other Canadian students. In addition to planning for the self-isolation period, the post-secondary institutions are finalizing operational plans for the 2020-21 academic year. International students arriving in Canada from other countries are subject to the mandatory requirement to quarantine for 14 days under the Federal Quarantine Act. On Saturday, 276 players and officials from the Canadian Premier League arrived in PEI via charter flights. I understand it went smoothly, with the first round of testing completed at the Delta within hours of their arrival. Prior to arriving in PEI, all participants completed at least 14 days of self-isolation in their home markets and had a minimum of 2 negative COVID-19 tests. Upon arrival, all participants were tested for COVID-19 and results were confirmed on Monday, and all were negative. Prior to beginning match play later this week, all participants will undergo a second test for COVID-19. All participants must have 2 negative COVID-19 tests after arriving in PEI and prior to their first game, and we look forward to receiving the results of this second round of testing later this week. Participants will be sequestered in a bubble at the Delta Hotel for the duration of the season, approximately 50 days. And at this time, there will be no spectators at the games. The only time the participants will leave the Delta Hotel will be to go to practice at the soccer pitch, play a game, or seek emergency medical care. The league is being diligent and is serious about COVID-19 restrictions, and I appreciate their commitment to following public health measures and keeping Islanders safe. As we enter our 6th month of dealing with COVID, we are redefining normal, and we are trying to look forward. We are very fortunate here for the many things that we are able to do. And on this beautiful day, I would like to thank Islanders and visitors. I'd like to thank our healthcare workers and our other essential workers. And thank you to the many individuals and groups of people who are working to keep Islanders safe and doing their part. So please continue to look out for one another. Be patient, be kind, and compassionate to yourselves and one another. Thank you. And now I'll open it up for questions.
Nicole Williams, CBC.
Hello to you both. My first question is for Marian Dowling. I know you mentioned that 48% of surgeries that were postponed have been done, but I know that means that there are still a lot waiting to be completed. I'm wondering if you could be specific about just how many are left to go and how long you think that work might take to complete.
Hi, I don't have the specific numbers here in front of me, but we could get those for you of how many are remaining, because it is a percentage that I've provided you with here today. But I'm very optimistic that we have been moving forward at a faster pace, I think, than we may have even anticipated over the summer months, while of course we're still trying to reschedule with the patient's own ability to come for procedures, as these would have been elective cases that we're trying to reschedule. So we know we've had a number of patients who've requested a later date when something's been offered to them. So we're really trying to work together with patients as well as with all of our staff, and doing an increased number of cases in the summer months while it's safe to do so and we can continue that. We're maximizing the time as best we can. So I really don't have an estimation of time. We've restarted this back in May, I believe. So we've made good progress because it was a short time where we really had reduced down to essential services that we're trying to catch up with again, and we're already almost halfway there. So I'm very pleased with the progress that's been made and appreciative to the staff in the operating rooms and the clinics that have been having to do all the follow-up and rescheduling of these cases, as well as to the patients who've been patient with us and also working with us to make sure we can meet their needs as best as possible.
Thank you. And my next question is for Dr. Morrison. I just wanted to know if you could clarify a little bit further on students from outside the bubble here, specifically Canadian students. Will those students have to self-isolate for 2 weeks when they arrive, just to clarify?
Hi, Nicole. Thank you for the question. Yes, Canadian students who are arriving here from outside the Canadian or the Atlantic bubble will have to self-isolate for 2 weeks.
Thank you so much.
Okay.
Allison Jenkins, The Guardian.
Yes, good morning. Good afternoon. I'd like to know, have there been any additional student services staff hired for students when they go back to school, just to help with the adjustment? In particular, any additional student well-being teams?
Hi, Allison. So I think that question is probably more specific to the actual education system or public schools branch. And my understanding is that they, if they haven't already, will be making an announcement about the number of new staff in various areas of the education system as they go into the fall. So I'll leave that for them to respond to directly.
Okay, thank you very much.
François Leblanc, Radio-Canada.
Oui, bonjour. La Ligue de hockey junior majeur du Québec nous disait qu'elle est en négociation avec votre bureau présentement pour pouvoir appliquer son protocole de retour au jeu qui a été d'ailleurs approuvé par le gouvernement du Québec. On se demandait où en étaient rendues les discussions avec votre bureau, puis qu'est-ce qui achoppe là, quelles sont les restrictions qui font en sorte que pour l'instant ça n'a pas été déjà approuvé.
Bonjour François. Alors, oui, vous avez raison, on est en train de discuter les plans pour retour au jeu. Et puis c'est un plan qui est bien fait, mais on est en train d'avoir les discussions à propos des spectateurs. Parce qu'on a des restrictions ici pour le nombre de personnes qui peuvent voir un match. Aussi, on a des questions à propos de quand ils arrivent, ils doivent isoler s'ils viennent de Québec ou d'autres régions du Canada, mais aussi qu'ils vont jouer entre les équipes juste ici au Maritime. Mais on a quelques questions, mais on est en train de les discuter. J'imagine qu'on va avoir une décision dans les quelques jours cette semaine.
Maintenant, eux autres aimeraient avoir, la Ligue aimerait avoir au moins 250 spectateurs qui pourraient assister au match. En quoi ça serait différent, par exemple, de la Ligue canadienne de soccer là, qui est présentement à Lille? Et puis, est-ce que vous allez en discuter pour avoir des choses uniformes entre les trois provinces avec vos collègues des autres médecins hygiénistes?
Oui, on est en train de discuter, je pense, 2 fois la semaine passée avec mes collègues Nouveau-Brunswick, la Nouvelle-Écosse. Mais on a des mesures de santé publique qui sont un peu différentes entre les trois provinces. Je ne sais pas si on peut avoir, si on serait tout en ligne, mais pour l'instant, on ne peut pas avoir 250 personnes ici à l'île du Prince-Édouard. Alors, ça va prendre plus de discussions avec la Ligue et les autres provinces.
Merci beaucoup.
Radio-Canada.
Good afternoon to you both. Une question pour vous en français, Dr. Morrison. Pourriez-vous préciser, expliquer quelle sera la procédure pour les étudiants de l'extérieur de la bulle atlantique, les étudiants postsecondaires qui vont commencer à arriver aujourd'hui? Qu'est-ce qu'ils doivent faire? Et vous avez parlé d'hôtels pour les étudiants internationaux. Pourriez-vous m'expliquer tout ça en français, s'il vous plaît?
Merci. Alors, les étudiants postsecondaires qui arrivent hors de la boule atlantique doivent, mais d'autre part du Canada, doivent avoir un plan d'isoler ici pendant 14 jours. Et puis, les étudiants qui arrivent des États-Unis, les étudiants internationaux vont être mis à un hôtel pour les 2 semaines et ils vont avoir la sécurité avec l'hôtel et aussi on va emporter les repas pour les étudiants.
Pour ces étudiants internationaux qui vont être à l'hôtel, est-ce qu'il y a un hôtel en particulier, plusieurs hôtels et qui va payer pour l'isolement et la nourriture de ces étudiants-là?
Alors, on est en les discussions avec l'université et les Holland College et on est en train de finaliser les hôtels, et puis ça dépend le nombre d'étudiants exact. Alors, c'est pourquoi les discussions à propos de quel hôtel continuent. Mais je pense que c'est la province qui paye pour les hôtels, et ça c'est qu'est-ce que je comprends.
Merci.
Louise Martin, CBC.
Oh, hi there to both of you. Sorry, Dr. Morrison, do you mind translating before I get to my questions? I believe you were asked about a sports league, but I missed which sports league and potentially some spectators at games.
Yes, thanks, Louise, because I'd like to just translate both of those last two questions I had in French. So I'll start with the latter one first. It was just around the students who are coming in to our post-secondary institutions from outside the Atlantic bubble will be required to self-isolate for 2 weeks and have a self-isolation plan prior to arrival. And the international students will be put up in a hotel who are coming for those post-secondary study here, and they will involve additional security and support there. The initial question, Louise, was around the Quebec Major Junior Hockey League and discussions with Nova Scotia and New Brunswick that we're continuing to have about their respective Quebec Major Junior Hockey League teams, as well as the one here in Prince Edward Island. We are in the process of looking at that plan and hope to have approval by the end of the week. And one of the questions was around spectators. So would there be 250 spectators or more at a game? And that would not be the case here in Prince Edward Island. Because it would have to comply with our mass gathering numbers in terms of spectators. So that is one of the questions we're discussing in terms of the proposal from the Quebec Major Junior Hockey League here.
Merci. I appreciate the translation. Thank you so much. So my question goes back to what you were talking about, the back-to-school plan and getting ready. And I know that Education Minister Brad Trivers had put on Facebook last week that the Department of Education is aware of some concerns about testing and will be working with your office and education authorities to provide some clarification. He said early this week. And it's really just around when a student in particular, or you could expand that to anybody, needs to be tested for COVID-19. You know, is a runny nose enough, for instance? How many symptoms do they have to exhibit to warrant a test? Because, and you and I have discussed this before, but we're coming into cold and flu season as well. So it seems like there would be a lot of people that would potentially need a COVID-19 test when they may just have a simple cold.
Yes, Louise, so interesting. We are in the process with education this morning. Actually, I left it to come here of a tabletop exercise as we work through some of those exact questions so that our education colleagues can also learn, and we all learn from practicing. So if there is a potential case identified with a teacher or a student, what does that mean? Who gets notified? Who gets tested? And who gets contacted in that process? And I think by working through that and making sure that's really clear, it will be really helpful when it happens in the school system. And so some of the questions, and I am not sure if Minister Trivers was referring to that kind of questions, that kind of question that we were addressing in our tabletop exercise this morning, but that's one general comment. But I think your point is really well taken, and we're conscious of that as we go into a respiratory season, that it will be really important to, of course, do the hand washing, stay at home when you're ill. And if you do have symptoms, and it's going to be hard to tell and challenging at times, is this another virus or is it COVID-19? And really getting tested and calling 811 or arranging it through your healthcare provider will be really important. And I think I know our lab is prepared for that. We've talked about that potential for increased tests. I actually wonder too if people are washing their hands and staying home when they're ill and following some of that public health advice, we may not see as many of our other respiratory viruses as we might have seen in a normal year.
Thanks so much. And I just a clarification on if you, and this could be for a student or really anybody, if you're told, you call 811 and they say, yes, you sound like you have a few symptoms or one or two and you should make an appointment for a test. What are the self-isolation rules at that point? Do you self-isolate until you even before you get the test and then your entire household, or do you wait till you have the test to get the results back? Sort of what are the rules around, quarantining yourself till you get the test results back and those in the same household as you?
So it's, and Louise, those are really good questions. And I think we've tried to continue to update some of the information on our website and we'll need to continue to do that. With those kind of questions in mind. So if someone has symptoms, for instance, we're talking about schools, they would go home and they would arrange for a test and they would self-isolate until that test was arranged and maybe it's a drive-through test and that's likely where it would be and so the drive-through test and they would remain in self-isolation until that test result comes back. And if it's a child, the child can't self-isolate by themselves, so it would mean that the other close contact, the parents, for instance, in the house who were in close contact, would self-isolate with that child until the results came back.
Thank you very much. I appreciate it.
Laurent Rigaud, La Voix avec le thème.
Good afternoon to you both. J'ai une question pour vous, Dr Morrison, en français. Vous avez fait un bilan de tout ce qui s'est passé depuis le mois de mars, de toutes les mesures qui ont été prises. Aujourd'hui, les voyages non essentiels sont toujours pas autorisés à l'île du Prince-Édouard. Est-ce que vous pouvez nous expliquer à quoi vont ressembler les prochaines semaines, les prochains mois? Est-ce qu'il va y avoir un peu plus d'ouverture? Est-ce que les gens vont pouvoir venir s'ils s'isolent 2 semaines pour n'importe quelle raison? Comment ça va se passer?
Salut Laurent. Alors, vraiment, vous parlez d'un boule canadienne et puis on ne sait pas encore. C'est possible que ça va changer, mais on dit toujours quand on regarde qu'est-ce qui arrive partout au pays, qu'est-ce qui arrive ici dans la province et au maritime, ou dans la boule atlantique. Et alors, je ne peux pas dire pour certains, ça ne me surprend pas si on va ouvrir encore dans les semaines qui suivent, mais on ne veut pas qu'on risque trop de cas de COVID-19 quand on est en train de planifier d'ouvrir les écoles. Et alors, c'est un balance entre le risque, mais l'importance d'ouvrir aux autres Canadiens aussi.
Merci. J'avais une autre question sur un sujet dont vous avez parlé il y a quelques mois, quand on parlait des tests. Je me souviens que vous aviez parlé des tests sérologiques, donc regarder s'il y a des anticorps dans le sang pour la COVID-19. Est-ce qu'il y a un plan pour ça? Est-ce que ça va venir à l'île? Est-ce qu'on va pouvoir se tester pour savoir si on est immunisé?
Bonne question. On est en train, vient avoir un proposal pour les tests et puis on est en train de travailler avec quelqu'un et la laboratoire pour avoir vraiment dans les mois qui suivent un plan pour faire les tests d'immunité ici à l'île du Prince-Édouard et ça va contribuer vraiment à la science parce qu'ils sont en train de faire la même sorte de choses partout au Canada et mais j'aimerais avoir les résultats dans les mois qui suivent, mais c'est en train d'être planifié et on a les personnes en place qui peuvent m'aider d'en faire.
Merci beaucoup.
Julien, au Canada.
Oui, bonjour, Dr. Morrison. Dr. Morrison, vous avez parlé des joueurs et des officiels de la CPL, de la Ligue canadienne de soccer. Vous avez parlé des tests. Concrètement, des tests ont été réalisés samedi à leur arrivée. D'autres tests sont réalisés cette semaine. Quelles vont être ensuite les procédures pour les 50 prochains jours? Est-ce que les joueurs, entraîneurs, officiels vont être testés régulièrement, chaque semaine?
Oui, exactement. C'est chaque semaine, après le deuxième test ici à l'île du Prince-Édouard, qui est vraiment le quatrième test pour les joueurs, les officiaux et les joueurs vont être testés chaque semaine pendant les 50 jours qui suivent.
Docteur Morrison, aussi, la situation à l'île du Prince-Édouard, on n'a toujours pas de cas de la COVID-19. Est-ce que vous imaginez que d'ici la fin du tournoi de la CPL, des spectateurs pourraient avoir accès au terrain ou d'ores et déjà aujourd'hui, vous pouvez nous assurer que jusqu'au dernier match, jusqu'à la finale, il n'y aura aucun spectateur, quoi qu'il arrive?
Je sais que j'ai pas reçu un plan, mais s'ils vont avoir des spectateurs, ils doivent mettre un plan opérationnel qui doit être regardé par nous autres au bureau. Alors, s'ils vont avoir peut-être 50 personnes comme spectateurs, ça doit être quelque chose qui est approuvé par notre bureau et on n'a pas vu un plan comme ça à ce moment. Mais si c'est un plan qui est soumis, ça doit être qu'il n'y a pas de contact entre ces spectateurs et les joueurs. Mais à ce moment, il n'y en a pas de spectateurs.
Est-ce que vous seriez ouverte à cette possibilité de voir des spectateurs?
Je serais ouvert si c'est le nombre de 50 qu'on a parlé et puis s'ils n'ont pas s'ils ne sont pas de mix entre les joueurs et les spectateurs et si on sont leur propre entrée, toutes les mesures qu'on a dans les plans. Mais alors, je serais ouvert, mais on va voir. Pour le moment, j'aimerais voir que tout va bien ici avec les joueurs et les matchs avant de considérer les spectateurs.
Merci beaucoup.
Just to quickly translate those last couple of questions. One was about after the test where the Professional Soccer League is done again, their second test this week before match play. They will be tested with staff every week during the period of 50 days they're here. The other question was around immunity testing and something that we've talked about a number of months ago, and that immunity study and serology testing is a proposal has been put together, and we have the people in place, and we anticipate moving forward with that immunity study for Prince Edward Islanders in the weeks and months ahead. So we look forward to having those results. So I think that's it. Anyway, thank you, everyone.